As children return to the classroom, scientists have warned of an increase in COVID-19 cases. So should we be worried?
I'm looking forward to having a full year in class, I hope. It'd be nice to get back to a bit more normality and getting back to school and doing the things we do, playing football with the lads.
In the coming months, a greater proportion of the coronavirus cases reported are likely to be from children, as adults have been prioritised in the vaccine rollout.
With children, with the greatest love in the world, they effectively act as bioterrorists. They spread viruses amongst themselves on a regular basis, and then they bring it home to us.
In Scotland, cases have spiked, particularly in those under 18, as the Delta variant circulates and schools have reopened. Though the number of young people in hospital has not increased, experts warn we could expect to see cases increase across all age groups.
Two things happen when schools open. One is obvious, young people mix. The other thing we know from research and polling is that when you take your kids to school, you can mix. So adult contact also increases when schools go back because there's less childcare required. So the whole of society has a bump when schools go back, and that adult group is what worries us actually more than the young people.
Coronavirus does affect children, but less frequently and seriously than adults. Those aged between 1 and 18 have much lower rates of hospitalisation and death compared with any other age group. They often don't develop any symptoms at all. Those they do get tend to be mild, such as a cough, fever or fatigue.
The vast majority will make a very rapid recovery, and for the children as a whole, there is very little to worry about. There is some interesting research out just today that's suggesting that children, however, are at risk of long COVID.
In some rare cases, children have developed multi-system inflammatory syndrome, or MIS-C.
What happens there is their body fights COVID, and once it's finished fighting COVID, the body turns on itself. And all of that inflammation then turns about causing cardiac inflammation, kidneys can become inflamed, the lungs become inflamed. The numbers of this with the original variants were extremely rare. We were talking less than 1 in a million cases of that, incredibly rare. What we still don't know, however, is whether the Delta variant, the new variant that's now in circulation, is going to increase the risk of that.
I'm looking forward to actually being able to see different classes.
As children return to the classroom, many of the restrictions in place before the summer have now gone. There will be no more bubbles.
No more bubbles. We're back in group.
Or isolation for someone who comes into contact with someone with COVID. Now students will just have to take a PCR test and only isolate if that test comes back positive. Home testing will continue for secondary school students, and there will be twice weekly lateral flows.
I'm really happy. I'm pleased that it's coming this year and not last year, to be honest.
I think it's time now. I think children have missed out.
In the US, the Centre for Disease Control has recommended children over the age of 12 be vaccinated, and the FDA has authorised the Pfizer jab in those aged 12 and above. It's also been authorised by the UK's JCVI, though at the moment only children between 16 and 18 can get the jab. Some believe they'd be better used elsewhere.
If our aim is to reduce the number of deaths and hospitalisations, then booster jabs are definitely what we should be prioritising above vaccinating children. Because I think there's a limited supply of vaccines and you're not able to do everything you want to do. But if we want to try and drive down the total number of cases, then we need to go into children.
The more infectious a variant is, the greater chance it has of spreading among adults as well as children. A variant could be more infectious in children for several reasons, including how many copies of itself a virus could make.
So the Delta variant can make nearly 1,000 times more copies of itself per infected cell than the previous variants. Now we're in a position where they can generate enough copies that if they cough in our direction, it may be picked up.
Or how well the key of the virus fits into the lock of your cells.
So that's the spike protein attaching to the ACE2. Now the Delta variant has a very good key. That key can fit into the lock very, very easily. That means you need a lower dose of the virus to infect yourself. With children, that means that previously their immune system was that active, it could get rid of the virus before it took hold.
The threat of new, more infectious variants means the approach to containing the virus could change.